Clinical case number 1. A 39-year-old man presented to the clinic with a high-grade fever, severe headache, generalized weakness, and abdominal pain. The patient reported that his symptoms had progressed over the past week. He also had a loss of appetite. Upon physical examination, the patient appears ill, and has a temperature of 102 degrees Fahrenheit. His abdomen is tender to palpation, and there are no specific skin rashes or lymphadenopathy. Laboratory investigations reveal leukopenia, thrombocytopenia, and elevated liver enzymes. Blood cultures are obtained, and the patient is diagnosed with typhoid fever. Now the question is, which of the following drugs is most preferably used for the treatment of typhoid? A. Metronidazole. B. Clindamycin. C. Tetracycline. D. Ciprofloxacin. You can guess the answer. You are smart. Yes. Your answer is correct. The right option is D, that is ciprofloxacin. The most commonly recommended antibiotics for treating typhoid fever are fluoroquinolones, such as ciprofloxacin or levofloxacin. These antibiotics are highly effective against the bacteria that cause typhoid fever. Therefore, the correct answer to the question is ciprofloxacin. Given the clinical presentation and the diagnosis of typhoid fever, the preferred drug for treatment would be a fluoroquinolone antibiotic such as ciprofloxacin. Ciprofloxacin is considered the first-line treatment for uncomplicated cases of typhoid fever in many regions. It is highly effective against Salmonella Typhi, the bacterium responsible for typhoid fever, and has a good safety profile. Ciprofloxacin works by inhibiting the enzymes DNA gyrase and topoisomerase 4 and disrupts bacterial replication, ultimately killing the bacteria. The typical treatment duration with ciprofloxacin for typhoid fever is 10 to 14 days. It is important for the patient to complete the full course of antibiotics to ensure complete eradication of the bacteria and to prevent the development of antibiotic resistance. Now, let's discuss the other options. Clindamycin is not typically used as a first-line treatment for typhoid fever. It may have some activity against Salmonella, the bacteria that causes typhoid fever, but it is not considered the drug of choice for this infection. Metronidazole is not typically used as a first-line treatment for typhoid fever caused by Salmonella Typhi. It is an antibiotic effective against anaerobic bacteria and certain parasites, but it lacks activity against Salmonella Typhi. Tetracycline is an antibiotic that can be effective against some types of bacterial infections, including certain strains of Salmonella. However, it is not widely recommended for treating typhoid fever due to concerns about increasing antibiotic resistance and the availability of more effective treatment options like fluoroquinolones. Clinical case number 2. A 28-year-old female presents to the clinic with a persistent cough, sometimes with blood, fatigue, night sweats, and unintentional weight loss. She reports that her symptoms have been ongoing for the past few months and have progressively worsened. Upon physical examination, the patient appears pale and malnourished. Auscultation of the lungs reveals crackles and decreased breath sounds in the upper lobes. A chest X-ray reveals infiltrates and cavities in the lung fields. Sputum samples are collected, and acid-fast bacilli are detected, confirming the diagnosis of pulmonary tuberculosis. Now the question is, considering the diagnosis of tuberculosis, which of the following is the preferred drug for the treatment of this patient's condition? A. Moxifloxacin. B. Ethanamide. C. Ethambutol. D. Linezolid. You have learned about it in detail. You can guess the answer easily. Right. Yes, it's right before your eyes. The preferred drug for the treatment of tuberculosis in this patient's condition is C, that is ethambutol. Ethambutol is a first-line drug used in the treatment of tuberculosis. It is commonly included in the initial phase of therapy for drug-susceptible tuberculosis. Ethambutol works by inhibiting the synthesis of arabinogalactan, a component of the mycobacterial cell wall. It specifically targets the enzyme arabinosyl transferase, which is involved in the polymerization of arabinogalactan. By inhibiting this enzyme, ethambutol disrupts the formation of the mycobacterial cell wall, resulting in impaired growth and replication of Mycobacterium tuberculosis. Ethambutol is particularly effective against actively dividing tubercle bacilli. It is commonly used in combination with other first-line drugs, such as isoniazid, rifampin, and pyrazinamide, to prevent the development of drug resistance and improve treatment outcomes. Moxifloxacin is used in the treatment of tuberculosis, particularly for drug-susceptible cases, drug-resistant cases, and as part of a combination therapy regimen. It may be considered as an alternative to other fluoroquinolones or in cases where first-line drugs cannot be used. Moxifloxacin belongs to the fluoroquinolone class of antibiotics. It acts by inhibiting the enzyme DNA gyrase, which is responsible for the supercoiling of DNA during replication. By inhibiting DNA gyrase, moxifloxacin disrupts DNA replication and transcription, leading to the bactericidal effect against Mycobacterium tuberculosis. Ethanamide is primarily used in the treatment of drug-resistant tuberculosis. It is often employed as part of a combination therapy regimen for multi-drug-resistant tuberculosis or when resistance to other first-line drugs like isoniazid and rifampin is present. Ethanamide is a prodrug that is activated by the enzyme ether within the mycobacteria. The active form of ethanamide inhibits mycolic acid synthesis, an essential component of the mycobacterial cell wall. By interfering with mycolic acid production, ethanamide disrupts the integrity of the cell wall and exerts a bacteriostatic or bactericidal effect against Mycobacterium tuberculosis. Linezolid is primarily used in the treatment of drug-resistant tuberculosis, particularly when other first-line and second-line drugs are ineffective or not tolerated. It may also be considered in cases of extensively drug-resistant tuberculosis. Linezolid is an oxazolidinone antibiotic that inhibits bacterial protein synthesis. It works by binding to the 23S ribosomal RNA of the bacterial ribosome, thereby preventing the formation of the functional 70S initiation complex. This inhibition of protein synthesis leads to the bacteriostatic effect of linezolid against Mycobacterium tuberculosis. Subscribe to our channel for more informative videos.